usual press box host on Friday is Jim Rupert, but he's out of town today and tomorrow, so filling in today, and at least some of us tomorrow, Steve Bridge and Tim Schweitzer, and we're inside the Shed Sports Bar at the Illinois State Fair on this Friday afternoon. And as you heard, broadcast coverage is sponsored all week by Springfield Clinic Orthopedics, walk-in at 800 North 1st. Dr. Rishi Sharma joins us from Springfield Clinic Orthopedics. How are you?
I'm doing well. How are you?
I know Pete Stoll, allegedly, I've heard this, Pete Stoll sits down before the football season and puts together a big matrix or spreadsheet of where everybody has to be for every game during the season so that all the Springfield Clinic staff, sports medicine specialists, surgeons, that you all have places to be on Friday nights for high school football.
Oh, absolutely.
Do you know where you're going to be, Dr. Sharma, on opening night 2 weeks from tonight?
I do.
And you will be?
Chatham-Glenwood.
You got the Glenwood game?
I got the Glenwood Titans.
Well, they play Saturday, at Memorial Stadium.
They do.
Yeah,
they do.
So do you get a Friday night off?
I might be covering the Jacksonville game.
Okay, so you might have the Crimsons on.
Yes,
that. On
Friday.
I think that means Pete's told you, please, Doc, I need you on Friday night and Saturday. Okay.
But I will be at the Chatham-Glenwood game at Lanphier on Saturday.
Good, because we'll be there as well. And in fact, Ryan Hickman, who's sitting in studio helping produce this show, is calling that game with Jim Rupert if Rupert comes back from Pittsburgh.
You think he's going to return from Pittsburgh?
I sure hope so. And that game will be on right here on 92.3 FM and 1450 AM, Glenwood at Lanphier, opening night, Saturday the 31st. Okay, Dr. Sharma, first off, Cole Hamels hurt his quad a few weeks ago. Did I get that injury right? Was it
the oblique?
Oblique, that's
the
what
oblique.
it was.
And he'd hurt the oblique before.
He's had oblique issues before. Talking about the Cubs pitcher, Cole Hamels. Big guy. Big, strong, strapping guy.
Kind of reminds me of myself.
I was about to mention that.
Just about an inch taller.
Just about. And he hurts the oblique. One of your specialties is non-invasive treatment for orthopedic issues, and that could be what? Could that be an oblique?
It could be an oblique. It could be.
So what do you do about an oblique? Especially
where's an oblique?
Where is the oblique? And if you're a well-tuned, in-shape athlete, why would you hurt your oblique?
You got to realize that muscles really can only take so much torque. And if you're talking about pitchers or athletes at that level, it is quite easy to pull any muscle in your body. When we're talking about the obliques, we're talking about the obliques in the abdominis, and the sheer torque of what they're doing by throwing a baseball at that velocity can injure just about any muscle in your entire body. Things that you could try doing, assuming it's just an isolated oblique tear and there's no underlying abdominal hernia or anything of that sort, one would try rehabilitation. Try to strengthen, some ultrasound, maybe some electrical stimulation to try to get that back doing the things it needs to be doing. We try not to push our athletes, obviously. I mean, we try to get them back as quick as we can. However, safety is our priority. And especially when you're looking at that level of competition, when you're talking about contractual agreements and you're talking about day-to-day game situations, postseason, potential postseason, there's a lot on the line if he doesn't return. However, the last thing you would want is for him to re-injure or injure something worse, and now he's out for the rest of the season.
And, of course, he comes back and was okay the first game that he pitched, but then the other night he gives up 100 runs and was terrible. So maybe that's just coincidence. He's pitching in Philadelphia where he used to pitch and hadn't pitched there in 5 years, and he had a terrible game. We don't necessarily attribute that to the oblique, but it is conceivable, as you mentioned, for just the reasons that they're in a pennant race and the guy wants to get back. Maybe he comes back a little too soon.
Now, there's an entire staff that's involved. You're talking about physical therapists, athletic trainers, the patient or the athlete. You're talking about administration or the Cubs organization. And then you're talking about, obviously, the individual itself has to think about if he's functioning at that same level that he wants or needs to be functioning at, or if he's lacking, do we just think about holding him out for another couple of days? Or a couple of games, for that matter.
Yeah. Okay. Now we'll move on to more important things, and that's treating Springfield area people for the ailments that they have at Springfield Clinic Orthopedics. And football season is at hand, and there's started practice. a couple of weeks away from games. Steve Bridge and Chris McLeod will be out at Rocket Booster Stadium 2 weeks from tonight with the Rockets playing host to Southeast in the season opener. And that game will be on Bob FM 96.7, of course. And at some point, there's probably going to be a kid in that game that's going to take a pop, and they're going to help him off the field, and they're going to start holding a finger up and seeing if his eyes move. And concussion protocol. And one of your specialties is trying to help athletes and everybody else deal with the potential of a concussion. First off, what's a concussion?
Simple. Concussion is a mild traumatic brain injury. We believe it's a chemical imbalance in the brain that leads to swelling of the nerves, which leads to symptomatology such as headaches, dizziness, irritability. They're irritable to bright lights, loud noises. They have difficulty time and concentration. They just don't feel right. If you ask a patient who has a concussion, what do they feel like? They feel as if they're watching television on a standard definition screen when up to now they've been watching everything on high definition. And really the protocol, when we take a look at these athletes, if fortunately Springfield and the surrounding area, a lot of these schools have full-time athletic trainers. And then there are quite a few schools in the surrounding areas that have part-time athletic trainers. And some of these part-time schools will also have a physician present, or the opposing team will have a physician present with IHSA guidelines that have been implemented. Coaches, officials, parents, athletes, they are well versed in understanding today what a concussion actually is and what potential long-term ramifications of a concussion may be. Now, if you take this 10 years ago, we had nothing to document on, well, we believe your child has a concussion, but we believe that's it. In today's day and age, with neurocognitive testing, we can actually show an individual who has given a pre-season test on their cognitive ability and compare that to a post-injury test and see where they're at, and which is no different than pulling up an x-ray and showing a parent or an athlete, hey, you've got a foot fracture or a hand fracture, but now I can actually cognitively tell you that, hey, this is what's going on. You've got a concussion and your cognitive markers are actually down and your symptom score is here, whereas where you were at the beginning of the season before you had your traumatic brain injury, your mild traumatic brain injury, this is where you were at. So that kid gets dinged, and no longer do we think a ding is a ding.
A bell rung, a pop, got slobber knockered. We've got a lot of these different names, and they all meant that you came out for a moment or two. Coach asked you where you were. You said here, and coach sent you back in. It unfortunately sounds pretty crude, but that's just the way, Dr. Sharma, that we lived our lives at that point in time, not thinking much more about it than we did.
Not today. Not today. A ding or a suspected concussion, the recommendation and suggestion is if you suspect a concussion in any athlete, whether it be a practice or a game day situation, that athlete should not return that same practice or game. They need to be evaluated. Now we have, and we're fortunate enough to have these our athletic trainers at these schools, and these athletic trainers work very hard with these athletes. They see them day in and day out, and they know if a kid is acting squirrely. They know where his baseline is from just interacting with these kids, and if they get dinged, well, that's a concussion until proven otherwise. So the athletic trainer will pull the athlete off of the field, and we'll take a look and evaluate them, and if they deem that a concussion may be present, they'll call myself or one of the other physicians who might be covering that event, and we'll take a look and evaluate them. If we believe that there is a concussion, that athlete is not going back in that same day.
Dr. Rishi Sharma is with us from the Springfield Clinic Orthopedics, and the Orthopedics walk-in at 800 North 1st is a good option no matter the ailment. If you have heard it, go see these guys. Steve Bridge is a hockey parent, and we talk about football being ripe for concussions. Hockey probably qualifies too, right?
Oh, absolutely.
And you see kids probably
Sure.
at even the age your son is playing.
And, the things that we get concerned about right now with the age group we have, and a little younger, honestly, is oftentimes it's almost a self-induced. Feet go out from underneath of you, and the back of your head hits the ice because you've slipped because you're playing on ice. We're going to get a year older and a level up in a year. We'll start to have a little more body contact. We'll start to see some more hitting along the boards. But I'm in a situation then, and all these parents are, or junior high football or other sports that we're all playing, baseball if you have a son or a daughter that catches, and softball, where you don't have a baseline. You haven't had because of the age of the player then. So how are mom and dad or a coach, as I'm a coach, supposed to go through and evaluate that when we're looking at something that we kind of know what they're like a little bit beforehand, but we don't have some extensive training after that to make sure we're doing right by everybody that's involved?
So in those situations, we believe that the neurocognitive testing is really only valid from age 12 and above. The younger population, we treat symptomatically, and we treat the same way that we used to treat our old, or 10 years ago, before we had the availability of neurocognitive testing. We based them off of symptomatology, clinical examination, and then we start progressing them accordingly. So we believe also that the younger the athlete is, the more susceptible they may be to developing a concussion, and the longer their symptoms may last. If you take a look at the average turnaround for a NFL football player to return to practice, is typically about 24 to 48 hours. Division I, about 7 to 10 days. The high school athlete, you're looking at somewhere between 7 days to about 21 days, and the younger it goes, the longer it may excel or exceed. Now, obviously, the mechanism is different. Some individuals are more susceptible to concussions. I use the term natural selection all the time. And what happens is when these individuals develop concussions, we obviously take them away from their sport or their activity that they're doing at hand, and we shut them down, we rest them, we monitor them. Obviously, the one thing that we always want to make sure, we're not dealing with anything else other than a concussion. So you want to make sure that we're not dealing with any type of intracranial bleed or any fracture of the skull or anything else that might be life-threatening. So in those situations, those patients are typically sent to the emergency room.
You got to go to the doctor.
Right. Yeah. You go to the ER and you get a CT scan of your head. A CT scan will rule out fractures, will rule out intracranial bleeds. Now, assume that that's not the situation. When these athletes, we essentially modify their activities. They come into clinic, we evaluate them. If we can get cognitive testing, we get cognitive testing. Even if they don't have a baseline, we can take cognitive testing on a 16-year-old who does not have a baseline and compare it to the national norm. Now, again, it's an average, isn't the greatest situation. However, what we can do is follow that neurocognitive post-injury test and see them subsequently and see where they are when their symptoms completely resolve and see where they were when they first began.
So they've made an improvement.
They've made an improvement. Individuals that you can't cognitively test, we essentially modify their activities. We avoid screen time. A lot of schools are now using Chromebooks, so we give them an order to take them off of the Chromebook. Sometimes we may have to take them out of school or put them in school part-time, and that's kind of our return to learn. So we pull them out of sports and PE, we modify their activities at school, we modify their activities at home, and you're not goofing around with brother and sister, you're not shoveling the snow, raking the leaves, you're just kind of taking it easy. Now, my personal 2 cents, if you're going to strain your brain, you're not straining it playing video games, you're doing it while you're doing your homework. And slowly and surely, symptoms will typically resolve. And when they do resolve, then we start a functional progression. So we evaluate them, symptoms are gone, clinical examination, they look great. We start progressing them under supervision. And what that typically entails is about a 3 to 5 day functional progression. Now, schools that have athletic trainers, it's already implemented. And what that essentially means is day one, these athletes are exerting themselves at about 40% of maximum heart rate. Day 2, 60%. Day 3, 80%. Day 4, cutting and pivoting like drills. Day 5, if we're going back to football, is light contact. You're doing great, wonderful. We get you back in doing things you need to do. Now, in those schools where we don't have athletic trainers, or your grade schools or your junior high schools, usually the PE teacher or usually the intramural coach will start progressing them. So we do have protocols in place, and we start exerting them accordingly. And after that 3 to 5 day functional progression, they're back doing the things they need to do. Usually they're back doing everything they need to do. Now,
is there, when we're watching this from the press box, or we're mom and a dad in the stands, or we're a coach on the sideline, is there one type of hit or what a hit looks like that causes a concussion? Can it be that easy? Is it to the front, to the back, to the side? Is it when your head turns around? Is it?
There really isn't.
There isn't.
There really isn't. We talk about different ways to prevent concussions. I mean, they've looked at mouth guards. They've looked at different types of helmets. They've got these sensors in helmets these days, especially at some of the collegiate levels and professional levels, to take a look at if there's a certain type of hit and if there's a certain impact that may make these individuals susceptible to a concussion. And so far, the data just isn't out there.
Dr. Rishi Sharma from the Springfield Clinic Orthopedics, and the Springfield Clinic Orthopedics walk-in. For folks that aren't familiar with this service offered, folks think they've got an issue, any sort of orthopedic injury or trauma, short of going to the emergency room, might not require them to do that. The clinic is open, right?
Absolutely.
And you would invite folks to come in and at least get an assessment.
Absolutely. Whether it just happened 10 minutes ago or whether you've been dealing with knee pain for the last 40 years, today's a great day. It's not raining out. The sun is shining. It's a little breezy out. I got to go grab some lunch. Hey, you know what? At the same time, I'm going to get my knee checked out. Come on in. We're open Monday through Thursday from 7 a.m. until 6 p.m. Fridays from 7 a.m. until 5 p.m. You know what? I went out to dinner last night. I kind of want to sleep in on Saturday. But you know what? Around 9 o'clock, I want to come in and get my knee checked out. That's been bothering me. We're open on Saturdays as well from 8 a.m. until 11 a.m.
8 to 11 on Saturday morning.
8 to 11 on Saturday morning.
So if you've got a high school kid who might be feeling the effects of the Friday night game, Saturday morning, come on in.
Saturday morning's during the football season, Saturday morning can get quite busy.
I can imagine.
Now, what we typically will try to do with our concussions more specifically is we really would like to test them. We would really like to do a neurocognitive test about 48 hours later.
Okay.
So about Monday, and typically the athletic trainer will relay that to the parents on Friday night, and the provider that's on the sidelines will actually discuss that with the parents. So that way it gives them some time to rest and take it easy. There's a lot going on in these individuals with concussions. But everything else, sprains, strains, you think you may have broken your hand or your ankle, we have you come in, we take an x-ray, we immobilize you if it's broken. If it's not broken, we figure out what we need to do to try to get you back as quick as you can.
Springfield Clinic Orthopedics walk-in at 800 North 1st. Dr. Sharma, thank you.
Absolutely. Thank
you.
you.
Job. Appreciate you coming by the shed here at the Illinois State Fair. We'll take a break and be back with more on Sports Radio 92.3 FM and 1450 AM. Stay tuned.